7:14 and back on Fox 24 Live. We are joined by Dr. Jason Bradley, his wife Rachel from Epic Functional Medicine Center, and down in Johnson County there. We've actually done a story with you before kind of about intervention, and it was involving a baby deer that showed up on your guys' porch. But we talked kind of about the foundational of functional medicine and your philosophies and approach to that. First of all, what is functional medicine and how it pertains to intervention and how to act when we feel sick or something's wrong?
Sure, yeah, thanks for having us here today.
Absolutely.
Functional medicine is a new approach to chronic illness, I suppose, management. As we know, America is the most expensive healthcare on the planet, and unfortunately we rank last in the Western industrialized world with chronic disease management. So functional medicine steps in and says, what if we're looking at the wrong things? And maybe we should be looking at the root causes of illness as opposed to just treating a disease. So what functional medicine is looking at is basically just teaching people how to be healthy again, jumping back in and how we should be eating and moving and sleeping and hydrating just to be healthy, and then looking at from a chemical point of view, what's in the body that doesn't need to be there that makes us sick, and get that stuff out of the body, and then what's missing from the body, whether it be nutrients or hormones or enzymes or probiotics, just to help us be healthy again. So it's root cause medicine, trying to help people just find health that have been suffering for a very long time. As
a medical professional, what brought you down that path of functional medicine? Because I'm sure it's not a path that people probably start on initially when they get into medicine.
Sure, yeah. It's interesting. In America, 4 out of 5 of us have a chronic disease, and 1 out of 5 of us have more than one chronic disease. And again, we're just failing horribly at this. American medicine does great with acute care. I always tell people, if you're bleeding out, if you've got an aggressive tumor or aggressive infection, go to acute care.
Sure.
But if you've been suffering for a long time, there's probably a different solution that's out there. And our goal, again, is just to find that root cause, find what's causing that illness, and help the body just be healthy again. My passion is to help people that have been suffering for a very long time and help them find that solution. And I love to see that transformation. It's my passion, it's my mission.
Sure. Rachel, what kind of services are at Epic that help people make that transformation?
Services, what we do is a little bit different. We offer programs.
Sure.
And so, it's not just go to the doctor and come back in several months. So we get people set up with a doctor, health coach, as needed to kind of support them and help them through the journey. We do a lot of comprehensive laboratory testing, so we're really digging deep into chemistry, blood. We look at everything: stool, urine. We pretty much look at all body fluids.
You got to get to the bottom of it.
Right, get to the bottom of things, and we just see great outcomes with that sort of an approach.
Our goal is to help people understand that getting healthy can be fun.
Yeah.
We have a lot of fun with what we do.
Sure.
We have a lot of fun with our clients, and I think that there's that stigma of I'm sick and I have to go to the doctor and then I have to take this pill or have this procedure done, and that doesn't sound fun to anybody.
No.
And I think that learning to be healthy again can be not only an exciting time, but then laying down that foundation to be healthy not only right now but for decades to come. I think that that's what I want to bring to the table. I want to bring fun and excitement to getting healthy and staying healthy.
It's a lifestyle after all. Living healthy is a lifestyle.
It is a lifestyle, absolutely.